Again, thank you so much for joining us this evening. I am at this time going to turn it over to Janelle Chandler, who is going to start the webinar and introduce our presenter for the evening. Janelle?
Hey, Tanya. Hi, everyone. Thank you so much for joining us on a very special presentation this evening. You will have the pleasure of hearing from Dr. McCauley, who is a board-certified urologist and specializes in female urologic health, in the treatment of urinary incontinence, overactive bladders, pelvic floor reconstructive surgery, female urology, and minimally invasive robotic surgery. Dr. McCauley has been in the Valley since 2011 and is now practicing with Valley Urology Specialists in Scottsdale. Without further ado, here's Dr. McCauley.
Appreciate it, Janelle. So I just want to take this opportunity to say thank you, and I really appreciate having the opportunity to be able to talk to people out there and talk about some very sensitive subjects that not everybody wants to discuss, and ultimately to leave this evening to know that there are options, and as we will talk about many times through this evening, that you'll be able to take the control back. So as you see here, I am Dr. Lipika McCauley. My office is based in Scottsdale. I'm with Valley Urology Specialists in collaboration with Honor Health and also part of Arizona Center for Cancer Care. I do specialize in female urology. I do most of all the female urology reconstructive surgeries and advanced therapies for bladder control and bowel control. And this does include male patients. So I do want the audience to be aware that not only do I specialize in a female population, but we do welcome our male patients as well, because this is something that male patients also experience, and want you to know that there are advanced options and medical therapies that can help you with your symptoms. So without further ado, let's go into the presentation and start talking about what are the issues we want to present tonight. First of all, I want people to understand that bladder and bowel issues are not necessarily considered inevitable. It's not an appropriate part of aging. Yes, things can change later in life, but it's not considered normal. If you find yourself with some of these similarities, this could be very applicable to you. Do you feel like there's times you're urinating more than 8 times a day? If you ever feel that sensation of you have to go now and you're desperately looking for the restroom, if you ever feel like you're the person who's consistently planning your activities around where a bathroom might be available, this can all be very applicable to you. A lot of people start to monitor what they eat, what they drink. They're limiting their fluid intake, which is not necessarily something we want, especially as urologists. We want our patients hydrated. If you find yourself using pads on a daily basis or even intermittently to control the leaks, that's something to think about. And additionally, a lot of people find that they're getting up frequently at night, which is bothersome because then it limits your ability to get a good night rest, and then you're fatigued in the morning. If some of these questions do sound familiar to you, I want you to understand that your body is trying to tell you something, and we will talk about the options to help you. Some of the questions that patients really come up with and come to me with and are concerned with is, oh my goodness, will I ever regain control? Can I go to an outdoor celebration? Can I get a job? People are limiting employment. They feel like they can't work. They're looking for disability. People limit their social activities, feel like they can't go on a date. Oftentimes people do feel very secluded and don't want to leave the house, which ultimately leads to social isolation and depression. And patients will limit what they're wearing. People feel like they have to wear black all the time to cover up the possibility of leaks. So they think, can I ever even wear white pants again? I want you to understand that these questions are not normal and that it is a time for a change if this is something you're experiencing. Understand there's greater than 60% of patients who experience bladder symptoms and they're using some kind of product to manage their incontinence. and that almost 50% of patients who struggle with urinary issues, whether that's urinary urgency, frequency, or even the loss of control of urine, about 50% of these people lose a sense of confidence, and it's affecting their lifestyle and their social interactions. So understand that you're not alone and it is affecting your life, and there are things we can do to change it, which is a great segue into the next slide, which is, again, you're not alone. And that's a lot of what I try to emphasize to my patients, that to not be embarrassed and to not feel isolated, although it is very hard to talk about these issues because it is very personal. Understand that ignoring these bladder control problems will affect your quality of life. And again, like we talked about, it'll affect social function, ultimately your mental health, and will affect your sleep. And bowel issues can also be very uncomfortable to discuss. We think bladder issues are uncomfortable. You start bringing up bowel control, and that is a really difficult question for patients to talk about or even bring up on their own. So it's often my responsibility as a provider to ask those questions. And I ask our primary care providers to dive deeper and ask those questions so people are more comfortable. Almost 70% of women don't even seek care because they're embarrassed, and close to 70% of men as well. And an alarming number, 88% of people feel like fecal incontinence or bowel control issues can really have an impact in their quality of life. So I want you to understand you're not alone. And again, we're going to continue to talk about therapy options for you and taking that control back. So let's talk about some of the potential causes of what can cause bladder and bowel control issues. Some of it can be really simple, and it can be related to your daily habits of what you're eating, what you're drinking, some of it based on schedule. Certain medications and supplements can also affect bladder function, bowel function. And then additionally, pregnancy, childbirth for female patients can affect control issues, as well as pelvic floor surgery or injuries. And I want our male patients to understand that the pelvic floor injury / surgeries is our men that undergo prostate surgeries and even different bladder procedures, that this can all affect your bladder and bowel control. When your body does function normally and properly, there are certain nerves that signal your brain when your bladder and rectum are full and need to empty. So when you experience some troublesome symptoms, there could be a disruption in this normal communication between the pathway of the brain and the nerves of the pelvis that ultimately affect bladder and bowel control. And those are some of the things we'll discuss today and talk about how there's therapy options to help get this control back. So what's the good news? So ultimately, the good news will be at the end of this evening that we will talk about some really exciting therapy options that a lot of people don't know about, as even people in the medical field who see patients with these problems on a daily basis don't really know that there are advanced therapy options that we can offer you and allow you to gain your control back. So we'll talk about the different steps that you can take to find this relief, and we'll talk about your journey. A little bit on what we're touching on of how does the bladder and the bowel control work. In general, there are nerves that tell the brain when the bladder is full and when the rectum is full, and that ultimately will give us an urge. And truly, if it's socially appropriate, then you take yourself to the restroom and you evacuate your bladder or your bowel. The problem is if there's a communication breakdown between the brain and these nerves, that's when the control issues occur. Unlike conventional treatments, and we'll talk about some of them, whether that's dietary changes, oral medications, or some other therapy options, Medtronic and sacral neuromodulation therapies stimulate the sacral nerves of the pelvis, which is more specific and can allow us to control the bladder and the bowel in a completely different way. That's what makes this really unique, and I want people to understand that. So what are some of the common bladder and bowel control problems? Let's talk about symptoms and what patients are experiencing. In terms of urinary incontinence, there is a type of incontinence called stress incontinence, and that's the leakage that occurs with physical activity, like a cough, a sneeze, laughter. And what's happening there is there's the lack of physical support to the urethral sphincter, which leads to what we call urethral hypermobility and causes this physical leakage of urine called stress incontinence. Now, that's truly separate from what we're talking tonight about, which is more the bladder symptoms, the urgency, frequency, and often that urge that leads to the uncontrollable loss of urine, which is called urge incontinence. And that's separate from stress incontinence. So I want patients to understand that. And that's what I try to do with my patients, to try to separate those symptoms and understand what's more present, because the treatments are different. So to understand that some of the Medtronic therapies that we're talking about tonight is not applicable to stress incontinence. Another condition is urinary retention, which could also lead to urinary incontinence symptoms, but we need to understand that urinary retention is a different condition, and that's the inability for the bladder to empty and even the loss of the sensation that your bladder is even full. This could lead to some leakage and dribbling, and the sensation is, oh my goodness, I'm still having incontinence, but it's happening for a different reason. And some patients who are actually obstructed or blocked, like for example, in our male patients who have prostate enlargement, may even require a catheter to be able to empty their bladder. This condition is also different, and I want people to understand, yes, there's treatment options for it, but it's different than what we're discussing tonight about neuromodulation and the impact between the nerves of the brain and the pelvic floor and the sacrum, and how that can help urinary incontinence. So understand urinary retention and incontinence that can occur because of retention is different and is treated differently. So what is overactive bladder? This is a big one, and this is a lot of what we're talking about tonight in terms of the Medtronic therapies that are available to you. Overactive bladder is that symptom of urinary urgency, frequency, and can often be associated with what we call urge incontinence. So what happens is you're getting a strong urge, and your body and your brain is not even giving you the time to make it to the bathroom, and causes the urinary leak, and that's called urge incontinence. How I describe it to my patients is, the bladder is a muscle, and if the bladder starts to contract, which is when we get a normal urge, as soon as that contraction is starting, if your brain and your nerves in your sacrum have lost the communication that should be normal, now the bladder and those nerves are doing their own thing, causing this urgency and lack of control before you can get to the restroom. And that's called urge incontinence. The other component is your urge to evacuate your bladder, or even your bowel for that matter, should truly only occur when your bladder has reached a capacity that tells the brain, okay, now I'm full, let's go to the restroom. If it's only been 15 minutes, half an hour, we physiologically know your kidneys have not made enough urine to fill your bladder to a capacity that should be telling your brain it's time to go. If this is occurring, and it's occurring frequently and urgently in a time frame that is unreasonable, that is also an indication that the communication between the bladder and the nerves, the communication between the brain and the nerves to the bladder and potentially the bowel are not communicating correctly, and that's what's leading to this increase of urgency, frequency, and potentially urge incontinence. Which leads us directly into fecal incontinence, which we started to touch on in that last slide, that fecal incontinence, again, is a recurring condition with frequent accidents where without the control, the fecal matter just releases without your permission. You can't resist the urge. You're rushing to the restroom, and you have oftentimes the inability to feel that the bowel is about to leak. Patients who struggle with fecal incontinence often are doing the same things as our patients with bladder symptoms. They're planning their activities around the bathroom. They're always looking for the bathroom. They find that they have involuntary loss of their stool, or even if they're just going to the restroom to empty their bladder, they're already seeing fecal smearing on their undergarments, and now they're ultimately using pads and some kind of protective undergarment because of the loss of stool. So understand fecal incontinence can be also part of this, and it's the same nerve that can potentially help you regain the control back. Which leads us directly into this next slide, which I love, is, well, how can we find more control? And how are the ways that we can treat incontinence and get you back to living a life that you're comfortable with and feels more normal? I like this slide because it does emphasize that there is a care plan, and there is a plan that we have for our patients. And I want you to understand that there is an algorithm in us treating you and a pathway that we can guide you through to get you to the right treatment options for you. In fact, I had a patient just this morning as we were implanting her device, and she had already shown great success. She asked me, how did I get here? How did I know that this was my problem? So that's a great question, and we're going to talk about it tonight. But to understand that I did take her through that journey to go through these steps to figure out, well, what is the next step in her treatment plan to give her the best relief of her urinary symptoms. I think the first part is to consult with your doctor, your primary care physician, often our GYN consultants as well. But for patients to be aware of, just ask the question, say something about your symptoms. Once you can say that to your physician, that will start your journey to get you into a treatment pathway and to the right providers. There's an assessment that is needed and initial treatment opportunities. And that, again, is part of the initial part to get you into this treatment pathway. And then to understand and to not be discouraged that if your symptoms do not improve, to not just ignore it and walk away, and to understand, follow up and understand that you can be referred to specialists who can help you with advanced therapies. So just that knowledge to not give up, and hopefully I will continue to reach out to primary care providers and other physicians to tell them, please don't let your patients get discouraged. And the moment you hear that they're still not having improvement, send them on to the next step so we can take them through the journey of getting to that advanced therapy option and getting their control back. So I do this with my patients, and I think it's very appropriate to start conservative. I tend to be very conservative as we start our journey because you can achieve some changes that are worthwhile and patients are happy with. So some of the first things we talk about is lifestyle changes. We call this behavioral therapy or behavioral modification. And it is true, there are some patients that really need to be educated on what they're eating and how their foods and drinks can really affect their bladder and bowel function. There are foods and drinks that are very well-known irritants to the bladder that will increase the urgency, frequency, and potentially incontinence. And patients don't even know it. But once you educate them on that and they make a few diet changes, it can make a significant impact. Exercise, on understanding exercise and specifically pelvic floor physical therapy can impact them. And there are a lot of patients and providers who don't understand or, quite frankly, aren't aware that there are specific pelvic floor physical therapists that help us with our patients to focus on that portion of their body to help them with not only regaining control of their bladder, but they work on things that are considered retraining that communication through their modalities as well. So I think it's very important to understand that our physical therapists, our pelvic floor therapists have a lot of opportunity to help with our patients and change how their symptoms are affecting their life. Now, there are two big classes of oral medications that have been around for a while to help with bladder symptoms. And these oral medications are designed to try to control that urgency, frequency, and ultimately urge incontinence. So the concept is, again, if the bladder is spasming and you can't control that muscle, the goal of the medication is to try to get that bladder muscle to relax so that the urge is diminished and you have better control. Now, the drawback to a lot of these medications is, number one, the ability to take them regularly, and that patients need to stay on it and stay on it daily. So that accountability can be very difficult. The cost can really vary, and that's frustrating for us too, because there are some nice medications that are relatively new with a better side effect profile, but are just cost prohibitive and patients just cannot afford it. The big thing about a lot of our bladder medications and what has been noted over time are the side effects. And this is across the board. Patients will struggle with dry mouth, constipation, blurry vision, potentially even changes in their blood pressure. And this is the big reason that patients cannot continue these medications. It's interesting because greater than 70% of patients within the first 6 months will just stop taking this medication because for a couple of reasons. They're discouraged because their symptoms aren't getting any better, or we're just making their side effects so severe they can't tolerate it. And it's kind of interesting. We're trying to help control overactive bladder, yet we're giving them dry mouth so they want to drink more. And we want to try to control bowel function, and yet we're making them constipated, which makes it worse. So some patients do well on oral medications, and I won't deny it. And it's still an appropriate place to start because, again, it's a conservative modality, and I agree with it. But understand that there is a side effect profile, and the ability to stay on it can be difficult. And again, to not be discouraged. And if you are a primary care provider or another healthcare provider, you need to understand that there's other options for these patients and not just the medication. Which really does bring us into the core of what we want to present tonight. What I want to present for you is these advanced therapies that Medtronic can bring to our patients, and something that I've been doing for my patients for such a long time and have seen such success and such change in quality of life that I want so many people to be aware of it. And these advanced therapies are for you to understand, are there for you when you feel like you have not gotten the change you want or the control you want from conservative therapies. And that's exactly what my patient was asking this morning when she said, how did I get here as we're going to implant? It was because she didn't get the change she wanted. She didn't get the control that she wanted. She was not happy. And we got her into an advanced therapy, and lo and behold, her life has changed, and she calls it life-changing. So there's two concepts again, bladder control and bowel control. And under bladder control, there's several different devices that we can talk about, presented by Medtronic, the InterStim device, Alta Vivo, which is a new device that is just very, very special, and we're excited to be able to offer this to patients. The neurosystem, and then we'll also touch on some of the injectable medications to help control overactive bladder and urge incontinence. Now, bowel control, the Medtronic InterStim system is what is indicated for fecal incontinence. There are some other surgical options. As a urologist, I don't offer some of the other surgical options. For you to know, those are questions we should truly bring up to our gastroenterology colleagues, and more specifically to our colorectal surgeons. In terms of treatment options for overactive bladder and urge incontinence, the prior slide was showing something about what's called an injectable therapy, and that's in reference to Botox. And what Botox is that it's an injection that goes directly into the bladder muscle. And again, the concept is if that muscle is spasming, and if we can inject a medication directly into the bladder, the concept is the bladder muscle will relax, and that urgency will diminish, and the control will get better. It can work well. However, it just targets the bladder muscle itself. It really doesn't have a good interaction between the brain and the nerves and trying to restore that natural communication that's broken down. And because of that, when the natural communication truly is not restored, there can be potential side effects such that the patients can't empty their bladder very well after a Botox treatment and might even need to self-catheterize. And in addition, the Botox is something that's considered temporary, so it does need to be repetitively injected, and patients on average will have to come back for treatments every 6 months. And unfortunately, the Botox is not indicated and has not been studied for bowel control issues, so it is completely separate. It's interesting, one study did find that close to 70% of patients discontinued treatment for their Botox after the first injection for several reasons, I'm sure, but I think the take home on this is that there's still maintenance to the Botox, and when we talk about some of our neuromodulation techniques, we offer that in reference to restoring normal bladder, bowel, brain connection in an effort to give you a therapy option that you can forget about it and hopefully go on with your lifestyle and take that control back. So let's talk about the different modalities of neuromodulation, because there's different ways we can do it, and this is what makes it really fun. This first one is called percutaneous tibial nerve neuromodulation. It's the Medtronic Neuro System. And what this does is, the concept is the tibial nerve, which is a nerve right behind the ankle bone, as you see in the picture here. The tibial nerve has the ability to communicate with the sacral nerves, which are the nerves that help control bladder function. And we have come to learn that if we could stimulate the tibial nerve with an electrical impulse, that it ultimately can give bladder control and reduce your urgency in a non-invasive way, which is really nice for a lot of our patients. The way it works is that you'd have to come to our office usually once a week for 12 weeks. That's considered the therapy standard. And when you're in the office, you pretty much relax. It's like almost a little acupuncture needle that's into the tibial nerve, and it's a 30-minute session. Now, after you've completed the 12 weeks and you have found that, yes, this is helping your bladder symptoms, then there is an element of maintenance, and that's usually once a month, or it could potentially be twice a month, depending on patients and what they're interested in. But there is an element of maintenance, and understand that the treatment initially is 12 weeks, but truly non-invasive and really well tolerated by patients. So this is something that I'm really excited to talk about, because this is new, and this is the concept of an implantable tibial neuromodulation system called AltaViva. This is FDA approved now, and is now clinically available in Arizona. I have a facility that is allowing us to implant and bring it in, so it's exciting because this truly is new. And the neat thing about this device is that once it's implanted, now you don't have to come back to the office. This is a small device that will allow neuromodulation to the tibial nerve automatically on a schedule that's already set, so that you don't have to worry about it and you can forget about it and take your control back. And it is indicated for urge incontinence. So I think this is really exciting. It's an outpatient procedure. It's a single procedure. It's a long-lasting device, anywhere from 10 to 15 years. And potentially we could use very minimal, up to no sedation, and still make the patients really comfortable. The question that often comes up too with neuromodulation devices too, such as also like cardiac pacemakers, is patients often feel like they are MRI restricted. So one thing to understand too with this tibial nerve device, that you are compatible for MRI and don't need to worry about any restrictions of that sort. So very exciting. And anybody who would want to learn more about it or come talk to me about it, I am more than happy to take you through this journey of AltaViva and the implantable tibial nerve device. But what's been around for a really long time, since 1997, is the InterStim system, which is the sacral neuromodulation device that's implanted. This truly targets the sacral nerves as specifically as we can to control the bladder and the bowel function. And it targets it by helping restore the communication that we've been talking about tonight, to restore that normal pathway between the bladder and the brain and the bladder and the bowel through the sacral nerves. And what happens with this system, when I bring it up to patients, sometimes it can feel overwhelming to start talking about an implanted device, especially in the sacrum, and people start thinking about their spine and what's going to happen. But I reassure you with, there's a test phase initially, and we'll go over it a little bit more, but the test phase will give you that ability to see for yourself if this therapy option is going to work for you. And more times than not, what happens is we get through this test phase, patients are so happy, their symptoms are markedly improved, and they're ready to move on to implants. So it's not me telling you about the implant and how great it can be in restoring your life and allowing you to take your life back, but for you to go through this journey and a test together so that you can see that this therapy can work for you. I also want patients to understand that this is also a long-term therapy, potentially anywhere from 10 to 15 years. And because it's implantable and in the buttock area, the goal is for you to not feel it or even know it's there. And what I really love is that there is a non-rechargeable device, meaning once it's in, you leave it, it's always running, and you don't have to worry about charging it. And, not having to think about it, I think, is a big aspect of not being constantly reminded that you do have a bowel or a bladder issue. And once this device is implanted and your life goes back to normal, then you can forget about it. So this is a little bit about what we're talking about in terms of the evaluation and the testing phase. And so what I love to tell patients about the testing phase is that there's no commitment to it. It truly is a test. If you felt like it didn't help at all, or if you didn't like it, there is an advanced test that we could always discuss as well. But the first portion is to truly just come to the office, and I put a very thin wire in your back in the sacral buttock area. And this is what delivers therapy to the sacral nerves. And this is all just external and taped to your back. And it's attached to a programmer that literally looks like your Samsung phone. And that's what's modulating your electrical stimulation over the next 3 to 7 days, potentially a week. And you go home with this running, and when you're home for the next week and back in your normal environment, you'll journal and take this opportunity to see, wow, is this changing my symptoms? Is my urgency better? Am I having less accidents? Am I using less pads? And with the journaling aspect of it, allows us to see some data objectively from what patients experience on a day-to-day basis, so that we can go over it together in the office and say, wow, look how amazing you did, and how your pad use changed, you slept longer, or you used the restroom a less frequent of times, and helps reiterate to patients, wow, this therapy is really working for me. And then to be excited about it and not to be scared about an implant or the next step. So I agree with the slide here in that say yes to the test. I really emphasize to patients to not be worried about the testing phase. Let's just at least get that done. And then you can assess for yourself if you feel that your symptom change is adequate for what you're expecting. So this kind of demonstrates that the test of time, and that the InterStim therapy has been proven and has shown that over many years, greater than 80% satisfaction for who use it for bladder control. I'd say that's pretty fair in my population too. If patients ask me about success, you have to be careful about what we mark as success. And to be honest, when we counsel our patients on this type of therapy, truly anything that's at least 50% better than your baseline is considered successful because it's a change and we want to get your quality of life better. And when you look at those patients, that population is greater than 80% that feel like, yes, I'm having a change that is positive. And in terms of their quality of life scores, there's greater than 3 times the amount compared to baseline if they're having, like what we talked about at the beginning of the presentation, where it's affecting their social life, their situations of interacting and going out with people, their mental health, or even their sleep. So greater than 3 times that effect has been improved. For bowel control, this has just been remarkable, and it came along a lot later than the neuromodulation for bladder control. So this has been exciting in more recent years, and close to 90% of patients have better bowel control, and that's something that could not be offered before, and again is truly life-changing because nobody wants to leak urine, and truly nobody wants to leak stool as well. And to understand, over the last 25 years, greater than 450,000 people have been implanted. So there are a lot of people who have been affected by this and have the ability to undergo life-changing treatment options. This slide is nice because, again, it just reiterates that the InterStim therapy is MRI compatible. I bring that up because time and time again in the past, there are patients who have multiple medical comorbidities that require frequent MRIs or just an MRI through their journey in life to help them with some other medical issues. And when you can't get an MRI because of a neuromodulation system, that's quite limiting in allowing the patients to undergo the healthcare that they deserve and may require. So this is really neat to understand that it's a full body MRI compatible. There's an MRI mode that you'll be able to put your device into from your programmer, and we would teach you all of this. And all this particular technology is based on something called SureScan technology, which allows things to be MRI compatible. And this is relatively new, so this is something that we're excited about as well, and has, I think, opened up the therapy to a lot of people who might not have been able to undergo this implant in the past. The other really neat thing about the Medtronic system is that there is an app, and this app will allow you to kind of track your progress, record your symptoms, put your medications in there. I think this is helpful because it allows us to track it objectively and look back and see how your symptoms are changing so that you understand that there is a true change and it's not just you, because when we go through our day-to-day life, we're not always aware of what we're doing. So if this app can so conveniently track it for you, I think it's really useful. And with that, I just want to conclude and say thank you again that I've been given this opportunity to share with you some of the therapy options that are out there and therapies that I offer my patients. The information is on the screen as to my practice and my location. And if anybody has questions, I think we'll open up the poll to some questions.
Absolutely. Thank you so much, Dr. McCauley. We greatly appreciate you taking the time to be with us this evening. I want to go ahead and open it up for questions. And as we're doing that, you will see another set of questions come on the screen. And we would very much like if you could go ahead and complete the poll that's there. And if you have any questions that you would like to ask Dr. McCauley, this is an opportunity that you get to have at this time. Your questions are anonymous, so nobody else sees that you're asking these questions. So if you have a question, you can go ahead and put it in the chat, and we'll be able to direct it to Dr. McCauley. So at this time, the first question that we would like to ask you is if you could talk a little bit more about what the trial phase is like before the permanent implant. What happens during that time?
Sure, that's a great question. So there's actually two types of trials, and I'll touch on both so that patients understand this. The basic trial is a trial that we do in the office. And what I tell my patients what to expect is you'll come to the office and you'll meet with our Medtronic reps who are so nice to be present and educate our patients and walk them through the process so they know they're going to see one of our reps from Medtronic. They will usually start with a conversation and start the teaching. And then I tell my patients they will be expected to lay on their stomach for a period of maybe 20 minutes. And I use a very small needle with a little bit of numbing medicine on their backside on the sacrum to place a tiny little wire. And I usually demonstrate by showing them my chain that I'm wearing, because this chain is ever so dainty and small that they understand the lead is quite small and to not be scared of it. And then I tell them that this is all just temporary. It's just taped to your back. And you just go home and go about your daily business, but start to journal and notice if your symptoms are changing. We do have to preface with some of the restrictions so that they understand there are some requirements from them, which is they can't get it wet. They technically shouldn't shower with it because we don't want any of the dressing or any of the electrical components to get wet. And to truly limit some of their physical activities. So no heavy lifting greater than 10 pounds, no crazy workouts. But I reiterate, it's short. It's just for a few days. And once you get a good trial and see for yourself that your symptoms are improving, then you just come back to us, or even at home if you're comfortable with it. We take off the tape, everything comes out, and you're done. And that's the aspect that I can really tell my patients, that none of this is committing you to anything. It's not going to burn any bridges, but is a great test to see if this therapy can work for you, and we can do it in the office. On the other hand, if someone is a little nervous and feels like they can't do it in the office, or if they did an office trial and they felt like, gosh, my symptoms did not improve, I don't give up. I tell them that there is what we call an advanced trial, where we do proceed to the operating room or to the surgery center, and I place what's considered the permanent lead, and it's placed with X-ray available. We have all the techniques to make sure we really optimize lead placement. And then again, it's still taped to their back. It's still temporary in that sense, and they go home potentially up to 2 weeks if they need it to really understand if it's helping their symptoms or not. And the 2-week trial is important because some of the bowel patients do not experience fecal episodes daily and can be more interspersed. So allowing them to have a longer trial can be really beneficial. And I take them through this journey to understand if we were to do a advanced trial, we do need to return to the operating room setting for a second time, whether or not that's for removal because you felt like it didn't work. But on the other hand, I usually leave them with, we'll return in 2 weeks for placement because you've had great success, and we'll put in your device. I hope that helps.
Thank you. You mentioned if it works or not. What do we consider it worked well? What's the efficacy? Like, is it going to give it 100% improvement? What percentage can a person expect to have as positive?
So that's a great question, and it is something I brought up briefly. In terms of expectations, I try to be very upfront and blunt with my patients in that nothing in life is 100%. I don't have a crystal ball. I can't guarantee anything. And we need to keep our expectations reasonable. Once you ground a patient with that and that understanding, I think it really helps. And to also understand with this therapy option, if we can at least show a change of 50%, that is considered successful. And again, it's not 100. It may not be perfect. But if we could give you a change that, say, if you're going through 10 pads a day and suddenly it's only 5, that's substantial, and it's worth making a mark over that and saying, yes, you've had success, and let's move forward with this advanced therapy option for you. But this is where it's very important for us to just be really open with our patients so that the expectations are out on the table and we know that we're working for the same goal, and just understanding at least a 50% change is considered exceptional.
Thank you. Another question, does Medicare cover this?
That is a great question. And I have so many Medicare patients, and my experience over the years has been, yes, Medicare covers it. Sometimes there can be authorization procedures that we have to go through to get this therapy for you. Sometimes it can involve me actually talking to your insurance provider so that they understand your journey and the other therapy options we've done. But this is absolutely an indicated therapy for our what we call refractory patients who have tried the conservative measures and the oral medications and other therapy options and have not had success. If you ever look at the urology guidelines and look at our guidelines for treatment of these symptoms, it is part of the algorithm to go on and offer advanced therapies to our patients, including neuromodulation. So to answer the question, yes, Medicare does cover it. And if there's ever an issue or if Medicare is trying to stop us in any way, then I try really hard to talk to insurance myself and get things approved for our patients.
Thank you. And so how often does an individual need to follow up or have maintenance for the visits?
That's a great question as well. So ultimately, I'd like you to forget about me and not have to see me as often, even though I love seeing my patients. So initially, after implant, I usually see patients back postoperatively in probably within the first 4 to 6 weeks, let the therapy start working for them. And then initially, I'll usually bring them back about 3 months just to check in. But truly, most of my implants, my neuromodulation patients, I see on an annual basis just to check their battery and make sure the device is still working okay for them. So it turns into a longevity type of therapy that you only need to see me once a year, and at that, even as needed. So I think it's really nice for the patients.
Perfect. Last question for you, Dr. McCauley.
Sure.
Can I exercise? Can I travel? And can I go through airport security?
Oh my goodness. Yes, I get these questions all the time. So again, this therapy is to, restore your normal activities and your normal lifestyle. So I restrict you in the first couple weeks after implant while the incision's healing. Those couple weeks is just, again, no heavy lifting greater than 10 pounds and no swimming or submerging, but allow that incision to heal. Once the 2 weeks is done, you are, from my standpoint, able to do whatever you would like, your exercise, swimming, activities that you want to participate in, because the goal is that this is restoring your normal lifestyle and your normal activities. And you absolutely can go through airport security and not have to worry. You will also get a medical device card so that if anybody stops you because of the metal implant, you have proof that you have a medical device. But ultimately, this goal is to forget about what you have and go on and live your life and do your normal activities. So I encourage that 100%.
Okay. Thank you all so much for being with us tonight. Thank you, Dr. McCauley, for taking the time to present this evening. If you have not done so, please be sure to go ahead and write down the phone number so that you can reach out to Dr. McCauley in her office and potentially schedule a visit or a consultation. We all hope you have a wonderful evening. And again, thank you for joining us.